Te acompañamos en los pequeños como en los grandes pasos de tu vida. Tenemos una manera de sentir la vida que compartimos todos. Es querer ser mejores en nuestras vidas y eso trasciende en nuestra profesión. Es una búsqueda, una forma de ser. Es creer en lo que hacemos, mejorar la salud y calidad de vida de las personas. Es una forma de trabajar con pasión, de aprovechar lo mejor de la ciencia para crear medicamentos y productos innovadores. Somos la tranquilidad que siempre va a estar de tu lado. Desde que naces hasta la plenitud de tu vida. Un camino que recorremos juntos haciéndonos más confiables a cada paso. Te acompañamos en tu nacimiento. Estamos con tu familia, tus amigos, tu trabajo y tu profesión. Y esa cercanía es lo que nos reconforta. Somos confianza en nuestros colaboradores. Somos cultura de excelencia y búsqueda de calidad. Pero sobre todo, somos bienestar. Megalabs. Somos bienestar.
Hola, nuevamente nos encontramos aquí para conversar con nuestros invitados. En este momento quería presentarles a la doctora Derya Tilki, que es uróloga especialista en cáncer de próstata en Hamburgo. Dr. Tilki, hi, how are you?
Hi, happy to hear you.
Yeah, it's your first time in the CAU Congress, no?
Yes,
yeah?
first time, and first time in Santiago de Chile.
That's nice, and I hope you like it.
I love it.
Yeah? Okay. You are an expert in prostate cancer. Can you tell us a little bit about yourself and where you work?
Yeah, I'm a urologist. I work at the Martini Clinic Prostate Cancer Center. It's part of the University Hospital in Hamburg, Germany. I'm very specialized in prostate cancer, as said. I'm also a vice chair of the guideline panel of the EAU for prostate cancer right now. Yeah,
that's nice. Martini Clinic is a specialized, only does prostate cancer.
Yeah, we only do prostate cancer, very specialized hospital, and we are the largest in terms of numbers for radical prostatectomy. We do currently 2,500 radical prostatectomies per year.
That's a lot. That's very interesting. Yeah. Not much people around us have the opportunity to work with those numbers and obtain science from them. Yeah. And what you've been talking to us about the new treatments, new markers, personalized treatment. What is your take-home message from your presentations?
Yeah, so I had a presentation on biomarkers in localized prostate cancer, about diagnostic markers and markers in the setting of candidacy for active surveillance. There are a lot of them out there. Some of them are really very well validated. They should be used with caution, not in every case where you also already have information by the clinical data, but you should use it when you have an in-between patient and when you really need some genetic information on top, because those markers are expensive. They are basically mostly available in North America, where insurance pay for the test, but in Europe and I think also in South America they are almost not available and much too expensive. The tissue-based biomarkers are about $3,000. The blood-based markers are a little bit cheaper, but still one has to be mindful when doing the indication. My other talk was on the controversial issue of lymphadenectomy and if it's necessary during radical prostatectomy. And I think it's a very important topic. One should be aware that the therapeutic benefit of lymphadenectomy has never been proven. It has a lot of complication rates. So now with the availability of PSMA PET, we really have to rethink the role of lymphadenectomy during radical prostatectomy. And I think there will be some changes when we have more experience with PSMA PET-CT worldwide.
Very interesting topic, because there's been new things. We see them coming out all the time for the decision making. Indocyanine green, and different types of lymphadenectomy,
Right.
and we never get a clear answer for prostate cancer.
Exactly.
Yeah.
Yeah.
And things have changed with the hormonal treatment for prostate cancer. What do you think about it? What can you tell us? Because for us in Latin America, this small change is a major issue in economics, in medicine, because every new treatment is very expensive. So is the benefit, the costs, what do you think about it?
Yeah, very good question. So there are very many advances. It's actually an exciting time to be in the prostate cancer field for the last 10 or 15 years even. Every year we have very big results of randomized trials in the big oncology meetings such as ASCO, ESMO, and so on. And what we uniformly see is that the treatment intensification and the treatment in earlier disease settings. So we become earlier and earlier, even now studies in lutetium therapy in hormone-sensitive disease. I think we will hear about new data at ESMO about PARP inhibitor combinations also used earlier. Right now we are using it at the MCRPC setting, but that will move earlier too. And it's a very big economic issue, of course, in countries where these drugs are not affordable. We will have to find a solution for that too. But right now, when only looking at the data, it's obviously a very exciting time, and one has to look what he can do to use this data and how we can afford it.
And what do you think is the future? Where does it take us? For example, artificial intelligence, genetic tailoring of our treatments. Will it change that way?
Yeah, I think it will go, and it is already more and more in the direction of very personalized treatment, not one size fits all. And we have heard, for example, at ASCO GU, new data on artificial intelligence, also in localized disease, for example, deciding for the addition of androgen deprivation treatment to salvage radiotherapy. So it all gets very exciting.
Yeah, and the urologist is staying with the prostatectomy. How do we get up this train of so many drugs, so many treatments? Should we do it? Should we let the oncology take over? What's your opinion?
I don't think it should be such a discussion. We are a multidisciplinary team. We should all work together, and we have a great team from medical oncologists, urologists, nuclear medicine specialists in our department, and I think across the world there are many of this kind. And I think we should just work together so we tailor the best possible treatment for the patients. So it's a disease which will be treated by more specialties than just one.
Okay, thank you very much, and I hope you enjoy here in Chile and that we meet in the future CAO meetings too.
Yeah, thank you very much for the invitation and the opportunity.
Muchas gracias a todos por atendernos. La doctora es una experta importante. Ustedes vieron una clínica de muchísimo volumen en cáncer de próstata, protagoniza mucho del conocimiento actual y es un agrado que nos acompañe aquí en el Congreso.